Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, this week, CMS announced a regulation known as the Home Health Regulation for fiscal year 2024. Why am I talking about home health? Because CMS included an orthotics rule in this same regulation. Doesn't mean that it applies to home health. It is applicable to all orthotics and prosthetics. But it's great news. We talked about this in June of this year when CMS proposed the draft regulation, and NAAOP and the Alliance partners submitted extensive comments and encouraged CMS to issue this rule in final form, and they have done so. Let me tell you a few things that the rule does. The first thing it does is codify the definition of braces or orthotics in federal regulations. It moves the current definition of orthotics or braces from the Medicare Benefits Policy Manual, which is just guidance. It's a guidance document, to the regulation that administers and directs providers under the Medicare program. This strengthens the braces definition and it stabilizes it, protects the benefit from future administrations that may come in and want to restrict the scope or the breadth of orthotics in various ways. So in that respect, it's great news. In addition, they've taken the exact language that was in the MBPM and have included that in the regulations. So there's no unintended consequences of updating that regulation and that definition. And NAAOP had suggested that CMS interpret that same language in a way that's more consistent with contemporary orthotic practice. CMS didn't say much about that in the final rule, but they did allow that instead of just rigid or semi-rigid orthoses, that they would consider coverage of more elastic orthoses in the future through future rulemaking. And that signals that the regulation may be open to broadening the definition of braces in the future. All in all, a great result. The second thing the regulation did was explicitly include coverage of powered orthoses. This is a major victory for the O&P field and for O&P patients. By covering power, making it clear that power technology is included in the Medicare benefit under the braces benefit, that essentially paves the way for a whole new family of orthoses to be covered by the Medicare program in the future. We already have a number of powered orthoses that are on the market and are available to beneficiaries. This will speed those technologies to the marketplace and allow beneficiaries to receive access to them in short order. So we're very pleased with that as well, and that we really view as a major victory going forward. And finally, the rule would explicitly state that shoes that are integral to a brace are in fact covered and paid for separately by the Medicare program. There was some ambiguity in the proposed rule that shoes are considered part of the brace if they are integral to the function of the brace, but it didn't make it clear that the shoes themselves would be separately reimbursable. In fact, the final rule clarifies at our request that they are indeed separately reimbursable under two existing L codes, one for men's and one for women's orthopedic footwear. So great result. The rule is out. We're very pleased with the result, and NAAOP and its alliance partners will celebrate this one and look forward to updating you on future O&P developments next month. Thanks so very much.